Hey, I have some exciting news to share with you guys. And maybe you already know by the title, but I just wanted to talk about this. One, I should also let you guys know that I didn't really record any of my top surgery recovery process or anything. Instead, I'll just talk to you guys through with it. I have some pictures. I'll probably like a picture right here of me just like in the hospital gown and about to get ready to go in for the surgery. And then here's another with me how many days, probably about a week post-op. I can correct myself if I'm wrong when I edit this. And here's another one with me at 5 weeks post-op. I am now 6 weeks post-op. I had my surgery on December 14th in Portland, Oregon at OSHU, and my surgeon was Dr. Berli. And I should explain that I originally had this surgery planned right when my spring term ended, which is also the end of school unless you're doing summer school kind of classes, summer classes. But because everything was happening with COVID at the time, that had to be canceled. I wasn't really happy about that in terms of having to wait a bit more longer again. I mean, for safety and because of my parents being at high risk because of their age to get COVID. Because I got mine December 14th, they have previously told me that I can call them and they should be able to set me up a time to get my surgery, since I already have waited enough. I've already been on a list with that surgeon to get it at that time. They said they can call out and they can get me scheduled as soon as possible. It's about 2 months or whatever, but when I called, I told them that I was ready to have it, and I believe it was like in October or sometime close then to October, November when I called. All the stuff that was happening that could potentially at the time, harm our rights, trans rights and stuff. So I thought it'd be a good time to do it as soon as possible before anything happened, if things did happen, if you know what I mean. But anyways, I am glad I got that done. And like when December 14th came, I was nervous up to the point, but I wasn't super nervous, but I was ready. I was ready to get through it and ready to get it just done with. When I had the surgery done in the few days of the process. Now the process itself was actually not as bad, but for everyone, their body will react differently to the process and the healing process and the pain tolerance and stuff like that. So the pain wasn't too bad, but I know when I got out of the surgery, I could barely remember coming out of that surgery. But I vividly remember sitting there in the hospital bed I was in and telling the doctor, not the doctor, but I think it's a nurse. I told him that I was a bit nauseous twice, and he gave me some stuff. And I think some lady came up and I was like, thank you for helping, especially during the whole COVID thing, which I thought was kind of funny, but I mean, it was also nice and very much true. Anyways, I remember that I was still feeling pretty nauseous, and this nurse, I think she was still practicing, but she was very nice, and she helped me with getting a drink and stuff like that. And before I had my mom come in and take me out of the place. Now I remember when I was in the car, I had the feeling of not wanting the sun in my eyes, the light was bothering me, and even the noise with me being deaf, I was able to take off my cochlear implants and just not hear anything, just, kind of close myself out of all that brightness that was happening. It was really strange, but, yeah, so I sat in bed, recovering in the guest room because this room up here is upstairs, and I didn't want to, have to go upstairs and be in my own bed while I'm healing. I mean, logically, you don't want to do too much, obviously, when you're healing and don't want to, ruin anything with the chest. Now with the chest, I did have a compression, band-aids on. They told me 4 weeks, and the light went away. Oh my gosh. Anyways, I will be my surgeon. I'll be seeing my surgeon, then he'll probably tell me a bit more about scar care and stuff. So that's why I'll show you guys my chest. Obviously, I'm sure you guys really want to see it. Because I'm not doing anything other than moisturizing some areas because I have some dead dry skin that just kind of peeled. So I have put stuff on there. My drain holes are all closed up and stuff. There you have a bit scabbed off. So there's this little marks there that it's still the skin is still I guess the coloration. I don't know how to describe it. The coloration of the skin is still it'll change over time like this. My skin in that area will go back to normal. It's a very interesting process, I have to say. I know that when my surgeon marked my chest, it was very I was very awkward about it because he kind of told me to put my hands down, up, down, up and down. I didn't. I'm not used to having anyone else, see that chest I had before, and that was a little weird. Overly, I like how everything looks. I know I was a little bit more worried about the scabbing on nipples and stuff like that, but right now it's still scabbing a little bit, but it's not a lot, but it's very minimal. Anyways, I will show you guys my chest now. So I'll get the light better here too. Give me 1 second. Okay, I just ate and my stomach looks a little bit but anyways, this is where my chest is. See my scar, right here. There's not, it kind of looks like it goes straight to the middle, but there's actually, not anything here. Or maybe the scar line that actually probably did come in through my chest here didn't, meet. I don't know how to describe it, but, yeah, so, on this side right here, I just say that, I had a stereo strip on here for a few more weeks from this one, because my last appointment, they took this one off, and I forgot what you call it. Is it PCN? I don't know which one, but she said to leave this on for about 2 or 1 more week. So I left it on until I was done with my compression. So I took it off. So this is what it looks like from after that, and you can see some skin that had peeled up and stuff. Yeah, this is a mark that's already kind of been there. I'm not sure what to do about that. This little mark, but it has nothing to do with the whole scar thing, anything like that. That's already there. It kind of looks like it's all. It kind of makes this look like it has eye bags or something. I think it's kind of funny, but anyways, yeah, I can see my drain holes I was talking about. I have a little mark here from the band-aid because my skin is actually pretty sensitive to certain band-aids and stuff. So it peeled off some skin here. It actually has healed over. It's kind of smooth. And this over here, yeah, I don't want to push or anything because I feel it might feel weird or something. But I was concerned about these at first because I didn't want any infection or anything like that. Because I thought I saw some real white stuff, but it was actually wet scar. It's kind of hard to explain, but I'm sure you can kind of search it up and see what I mean by that, wet scarring. Yeah, but I think this looks pretty good. Yeah, there's some skin that's kind of starting to heal a bit over it. Yeah, my nipples are doing pretty well. I can see the scabs right here. I felt a little something poking out here. I might ask my surgeon about that, but I can't see it anymore, so I don't know what that was about. But yeah, over here the scab has completely kind of come off. I can't try the scabbing just a little bit right here, but most of the scab has come off, and this is all that new skin. There is a little bit of color there, but it'll be a while till this gets like full color back. I don't expect a whole lot from that. Oh yeah, here's the other side. Yeah, I think this side kind of felt a little bit more, I don't know how to describe it. Felt, sometimes I still feel a little bit of pain, but I think it's like more like nerve pain. Or if I'm pressing on an area a bit, I can feel a little bit of soreness. It's kind of hard to tell if there's any swelling. For my whole healing process, I didn't have really bad pain. I kind of took more Tylenol than I did the medications that prescribed me. I did take those that they prescribed me for the first week, but kind of after that, it was more like Tylenol, and I just felt like more like nerves trying to come back, and a lot of itchiness. I felt a lot of itchiness more. I think it looks great. I don't see any stretching so far, and these marks right here, just like, I guess they're like leftover stretch marks. I didn't notice this here at first. I just thought it was just the skin, but yeah, there's a little bit stretch marks here. There's a little bit discoloration, but I think that has to do with the band-aids that peeled off some like skin, and the skin has peeled a bit. I have quite a bit of skin that peeled a bit, and it wasn't that great, cause like I know I couldn't like completely like get this area wet even when I was taking it. Like I took more like a bath instead of shower. But other than that, I say it looks pretty good. I know you can see my ribs out here, it's a little bit, but I think they told me that I had asymmetrical ribs. I wasn't expecting to hear that, but it's kind of funny because like I had noticed that my right side always seemed a little bit bigger than my other side. And I heard that was like completely normal as well. I didn't think much about it until they told me I had asymmetrical ribs. I'm like, oh, that might have explained why one side was a little bit bigger than the other. So that's fun. But I think most of them might have to be due because that's the scoliosis. But it's not like majorly bad, but I haven't had it checked out since I was in middle school. So maybe I might get that checked out sometime. It's really strange though, because you can see it protrude out a little bit. You can see it protrudes out just a little bit. Like, it doesn't bother me, but it does. It's a little strange. I mean, anyways, I think that is where I'm gonna end this video. I plan to talk in another video about switching over to T-gel from doing shots, and I'll explain why I made that choice and how I feel about it being on T-gel instead. And I think it'd be fun to do another video of me trying on some clothes I have and do this like little, I don't know, fashion montage, just to try on some clothes that I haven't got a chance to really wear because I felt conscious about how it looks, especially in my chest area, obviously. So I think it'll be fun to do that. Anyways, I felt that making a video after my Wednesday appointment in terms of scar care, I think it'll be fun to try to do like a Twitch or a live video, but I'm not quite sure. Maybe you guys can suggest some things down below. But anyways, so I'm gonna go and finish eating some of my pizza that I have, and yeah, have a good day. Bye.